السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه وسلم وعليه تسليما جميعا كثيرا. Welcome to MCB Community Briefing and question and answers on preparing for winter and the second COVID-19 wave. When the first wave was at its height, the MCB, Muslim Council of Britain, was organizing almost on a weekly basis these community briefings, and they came together organically, bringing together experts in variety of fields and variety of areas to talk about issues that are relevant to the Muslim community. And the reason why this was incredibly useful was because there's so much confusion out there. We already can see this. The rule of 6, who should go to school, what symptoms count as COVID, what about this vaccine, that vaccine? You're almost getting bombarded with information, and sometimes information is not clear, and sometimes it can be different for different regions, and sometimes they can contradict each other. And the lack of clarity or miscommunication is bad at the best of times, but during a pandemic, it can mean the difference between life and death. So this is a very useful initiative that has come together to bring together key voices to explain to the Muslim community, hopefully bringing together the different amount of information and put it in front of you in a way that's easy to understand, easy to grasp, inshallah. So today we have 3 experts talking about 3 different aspects about the second wave. Before I continue, it's worth telling everyone that this meeting is being recorded because a lot of people watch it on YouTube afterwards, and it's also being broadcast on Facebook. So just to be aware of that, and there will be a chance for you to ask questions and answers. We will try to keep it brief, inshallah, and we hope that this will be the first of restarting as the second wave progresses. May Allah SWT protect us from it. I'll begin first with a very short ayah from the Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Allah subhanahu wa ta'ala says in the Quran, إن أحسنتم أحسنتم لأنفسكم وإن أسأتم فلها فإذا جاء وعد الآخرة ليسوءوا وجوهكم وليدخلوا المسجد كما دخلوه أول مرة وليتبروا ما علوا تتبيرا. Well, Allah subhanahu wa ta'ala says in the Quran, if you do good for yourself. And if you do evil, you do it to yourselves. And then when the final promise came, we sent your enemies to sadden your faces and to enter the temple in Jerusalem as they entered it the first time, and to destroy what they had taken over with a total destruction. This ayah is with regards to the intransigence of the Bani Israel, where they had deviated from the path of Allah subhanahu wa ta'ala, and Allah subhanahu wa ta'ala sent the punishment upon them. Later on, they went down that same road again. They deviated again. They made the same mistake twice. And because they made the same mistake twice, Allah subhanahu wa ta'ala sent the same punishment upon them again, that the temple was destroyed, and it made them sad, it made them humiliated, it made them feel upset. Now, in it, there's a lesson for us. We've had the first wave of COVID, and we have suffered. Many people have died. The economy has been in free fall. People's lives have been put on hold. And if we don't learn the lessons from the first wave, then surely it is from the Sunnah of Allah that He will send a second wave to make us learn that lesson again, if we don't learn it from the first wave. This is why the Prophet ﷺ said words to the effect that a Muslim is not bitten from the same hole twice. We should learn our lesson from the first wave. We should try and make sure that we do not make any of those same mistakes, that we do not replicate it, so that inshallah Allah subhanahu wa ta'ala hopefully will protect us from the worst effects of a second wave. So this is, without further ado, just an introduction of why it's very important for us to pay attention to what the speakers have to say. So we have 3 speakers. And the first of these speakers is Sister Nuzhat from the Muslim Network Health Collaboration. She's works in Public Health England. She's very senior over there and is giving advice to the Muslim community, especially on public health matters, for a long time. She's also the chair of Muslim Women's of Merton, which is one of the affiliates of MCB. So Sister Nuzhat will be beginning to talk to us a little bit about the importance of getting the flu jab and operation vaccination. Without further ado, Sister Nuzhat, if you could take over.
Jazakallah. Thank you very much, Mohamed. Can you hear me clearly?
Yep. Yes, we can hear you perfectly.
Excellent, super. Right, okay. So without further ado, let me start, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, everyone. Wajid touched on clarity of information and how important and key it is, and I absolutely cannot agree more with him, and especially at these times. And you'll be aware over the last 6 to 7 months from all the media activity and the community activities that have been taking place since the start of COVID, the Muslim community, specifically Black and Asian communities, have been disproportionately impacted. And now with us moving into flu season, there is evidence to indicate that that also then will put potentially BAME communities at a higher risk. So we need to be prepared. We need to be prepared ourselves and also prepare our communities. So I'm going to cover 3 specific points. So one is around, why is the flu vaccination important? And why is it so important now during the COVID-19 pandemic? What flu vaccines are available for us? And the third key point that I'm going to cover is asking for us as Muslim communities to come together. It's a call to action so that we can increase the uptake of the vaccine within our communities. And we involve qualified volunteers to support the campaign, working closely with our local commissioning groups, health commissioning groups, and also local authorities. And the third point that I will touch on is the use of the excellent toolkits that BIMA and others have developed and are available for us to be guided through what we need to do. So I think what's important is, and I've touched on it, that evidence has suggested very clearly that Muslim communities in the UK have suffered more serious health effects from COVID-19, and this has been evidenced in a number of different journals and studies. And the death rates amongst Muslim males and females are disproportionate compared to other faith communities, and that evidence is in National Office of National Statistics, their government statistics, and that's all very clearly laid out. So it's not MCB saying this, but this is coming from government statistics. So flu threatens to further complicate the health issues in our communities this winter, and therefore it's so important that we learn the lessons of what has happened in the last 6 months and that we're prepared. And one of the things that I often get asked is that why are we disproportionately at high risk? And the causes are very complex and they relate to multiple factors, socioeconomic, physiological factors, but that is a whole webinar probably in its own right. So let's focus on what is flu and why is it so dangerous in this time of COVID. So flu or influenza, the term which is used in the medical world, is the flu season has now started. Usually it's around about sort of mid-September onwards. So we're in flu season currently. And flu affects our immune system, making it easier for us to contract infections such as COVID. And if someone is suffering from any other illness, contracting flu at the same time makes the suffering worse or actually has more detrimental impact and can last longer. And vaccination against flu has been shown and evidence to protect us by stopping the spread of it within households, within communities such as schools and mosques, and also reduce admissions to hospital. And this winter, the flu vaccination levels in the winter, flu vaccination levels have dropped across the UK in recent years, and particularly in Muslim communities. So that's good news. So we are getting the message out there. But this year is unusual because, as I mentioned, because of COVID-19. And in terms of what are the types of vaccine that are offered and are being offered this autumn, so the vaccine is being offered to all school children. And I know in some boroughs the letters have already been sent out to parents about the offer of the vaccine. It's also available for people aged 65 and over, anyone with a long-term illness such as asthma, heart problems, diabetes, and anyone who cannot fight infection properly, i.e. they are immunocompromised. However, also to add is that anyone within the community currently should be looking to take the flu vaccine. So in addition to those groups. So one of the main reasons for vaccinating children specifically is because they are spreaders. You've probably heard about sort of super spreaders. And that's for a number of reasons, because of maybe, poor hygiene habits, not washing hands, coming into contact with other children, grandparents, parents, etc. So they are sort of a source of spread. But if children are vaccinated, they are less likely to spread the infection to others, so others in the community are also then protected. And it's extremely important that we increase the number of children specifically that are taking the vaccine up in Muslim communities this winter, because there is evidence to indicate that potentially this winter the flu may be worse because of the COVID-19 infection that is also spreading. And so therefore that's why MCB, BIMA, Public Health England, Muslim Health Collaboration and others have come together to launch this campaign and increase awareness within our community about the importance of flu vaccination this winter. So the other point that I think that's very important is about what flu vaccines are available. So currently there are two different types of flu vaccines that are available. There is the injectable flu vaccine, and this is mainly used for adults, and it does not contain porcine, which is pork gelatin. And then the other type of vaccine is the nasal spray vaccine called Fluenza Tetra, and it's used in all children from the age of 2 to 18 years old, except obviously for those people that might be allergic to this vaccine. And I will point out that this does contain porcine. Now, I'm not going to go into any detail around the fatwas around whether, there's a lot of literature in this, and I think we can discuss whether it is available on MCB website or not. I'm not sure, but there are fatwas around the use of nasal spray vaccine for children. So those are the two types of vaccines that are currently available. And in terms of what's been happening across the UK, it's taken many years of campaigning across the UK by BIMA and colleagues to actually get to the point where the injectable inactivated vaccine for those people who object to the intranasal Fluenza Tetra is now available. That wasn't the case previously. However, I will just mention that at this point, I mean, we're in October at the moment, and I'm aware that there are logistical delays in October of that vaccine being available. to those people who are not in the very high risk groups, which I mentioned earlier. But the vaccine will be available towards the end of October, early November. This is what I'm aware of. So how do we work towards increasing the uptake in Muslim communities? So I mentioned three points. So one is around actually getting the message out into the communities, and we want to help communities improve the vaccination rate, to keep us all safe, keep us all healthy. And therefore, we're encouraging all our affiliates and communities to undertake efforts to ensure their own families are vaccinated, but also those that you might be coming into contact with as well. Those who may be at risk because of age or vulnerability, but wider as well. And therefore, this campaign is designed to help communities to make contact with your local CCGs, clinical commissioning groups, and local authorities to work closely with them. And the materials which are available on the website, on the MCB website, are tailored in such a way that you can add your own logo to the resources. And so the other key point is, I guess, really how we can activate and involve our volunteers to speak to the CCGs, to get involved with local authorities. And it's, I mean, a lot of the work that we all do, it's on a voluntary basis. And so I would urge everyone from sort of today really to start thinking about who those potential people might be that can reach out to your local groups. And there has been success in many parts of England, specifically Luton and Bolton, where there's been some excellent work that's been happening, and the toolkit that's been developed is based on a lot of that work that's been happening in some of those areas already. So the tools are available for you to utilize, add your logo and tailor them for you. And all the information that is needed to distribute is also there. So time is really short. We're in October at the moment, and a lot needs to be done between now and the next few weeks, really, couple of weeks, I would say. But working together with your local health authority, with the local CCG is really important, so we can actually save lives. And you're probably all listening to the news at the moment in terms of what's happening with COVID. So we need to learn the lessons of what's previously happened and really sort of up our efforts in this respect, inshallah. And we need to ensure that our Muslim children particularly are vaccinated this winter to deliver the biggest flu vaccination program that we can. And that also is really important because that sends a very strong message to industry and pharmaceutical companies and government that are producing vaccines, that we can actually say to them that actually we are increasing the uptake of vaccines in our community, and therefore we need vaccines that do not have porcine in them. So I'm going to stop there and hand back over to Wajid.
Jazakallah khairan, Sister Nuzhat. Thank you so much for that, and for giving us those practical tips on the importance of why we need to increase the uptake of flu vaccine. There is a question in the audience, and I know that you might not be able to stay to the end of the Q&A, so I thought we'd ask at the moment. Yeah. That can a child be administered an injection instead of the nasal influenza, as you said, it contained pork?
Yeah, the children can have, so the letters that will have gone out should have the option of the nasal spray or the injection. So yes, they can. Absolutely. But I just want to sort of point out there, and I think, Wajid, you've put up the poster as well, thank you very much, that the effectiveness of the spray is higher than the injected vaccine. That is the main, so one of the main differences. So yes, if you don't feel comfortable actually having the nasal spray, then yes, the injection can be used, but the effectiveness is not as high as the spray.
Okay. Are you aware, just to be absolutely clear, are you aware of any reason why Muslims should avoid the flu vaccine injectable, where there might be a difference of opinion, scholarly difference of opinion on the nasal one? Is the injectable one, are you aware of any substantial?
I'm not aware of any. There's nothing in that injectable vaccine that should cause concern from the Islamic perspective.
Or what about the people who are worried about, the COVID vaccine or whatever? Is this any relation between the COVID vaccine and the flu vaccine?
Is there any relation between the COVID vaccine? We don't have a COVID vaccine at the moment, so I'm not able to respond to that point. But yeah, I mean, we don't have a COVID vaccine that's available for the population at the moment.
Jazakallah. Thank you so much. I think that was very clear and really appreciate what you're saying. Please do go to the NCB website and check out Operation Vaccination. There are leaflets for your mosques, for your madrasas, your Muslim schools. There are answers to your questions that you can have. You can add your own logos like the Council of Mosques have done over there. But please do help that, because this is a really good chance to increase the flu vaccine uptake, as Mr. was saying, which will really help Muslim communities and can save lives. It's been proven to save lives. Jazakallah khairan.
Just one last point I just wanted to sort of really stress on really is that I think the message in terms of getting it out to the community, and especially those people that have children or those in the vulnerable groups that I mentioned. I mean, the flu vaccine usually is always sort of very, very prominent in the 65s and those with long-term conditions. But this year, there's a real push on school children to really get those messages out to our communities, families, etc., to keep safe, because we're going to hear from Brother the next speaker about the second wave, which we're expecting.
Which brings me on nicely, Jazakallah khairan, to Dr. Imran Qureshi, who is a consultant microbiologist in South London, and also is involved in training medical students and junior doctors at a high level, mashallah. And he's been instrumental in helping us from the beginning of this pandemic to try and contextualize the medical evidence in a way that's relatable to the community. And that's what we want him to do now, because, we're all dancing around this question is, are we in a second wave? Is it here? Is it not there? What's going on? It sounds like there's a threat level keeps going up, but are we there yet? And what does it mean? So to go into second waves of infectious diseases, I hand over to Dr. Imran Qureshi.
Jazakallah khair, bismillah ar-Rahman ar-Rahim, alhamdulillah, salatu wassalamu ala rasulillah wa ba'd. I really appreciate being invited once more by BIMA to, as a part of BIMA actually in this particular area to provide some new information, or not necessarily new, but just to contextualize. I think, as Wajid was saying, there's so much information that goes around in the media in particular, and I think it's important to get some idea of what we're, where we're going, what the trajectory is, what some of the challenges are going to be, and to think about some other things other than COVID, which I think some people may be surprised by that point, but I think it's important to talk about that. Now, if it's okay, Wajid, I'm just going to share my screen.
Okay, so I'll start sharing mine, and if you could, yes, you can go ahead.
Can you see? Just check. Let's go to that one. I think this is correct.
Yeah, you can see it now.
Yeah, perfect. Yep. Okay, so let me just get rid of that. Okay, so I'm going to start by talking about COVID, because obviously that's what people want to hear predominantly about, and we are definitely within the second wave now. I think it's safe to say that, certainly as somebody who deals with the results of samples that are taken by patients, and certainly within my hospital, there's been a definite increase in the last 2 to 3 weeks of the number of positives that we're getting, and we haven't seen positives for weeks. And now, there's just it feels like the first wave all over again. So I think we are certainly within the second COVID wave. And if you look at some of the data from the government's website, you'll see that the total number of people being tested daily is increasing, and you'll appreciate that, from the 1st of February all the way to the 1st of October, and we can see that the numbers of people being tested with the confirmed test has risen quite dramatically, and we're seeing larger numbers than we did within the first wave, which is troubling and should be concerning us all, because you'll all have noticed that we had a significant amount of mortality from the first wave of COVID, and now we're seeing daily figures which are higher in the second wave. So troubling times, really. In the cases by date reported, this is just another view of this information, where we're seeing significant numbers, again, much higher than we were seeing in the first wave arising. And I think we're just at the point in the next few weeks where I think we're going to become overwhelmed all over again. I mean, our hospitals are holding up for the moment, and that may be for a number of reasons. That may be partially because of some interventions by the government in terms of the rule of six. Also, people are now having to wear masks outside in public spaces, such as supermarkets and other places like that. There's obviously some restrictions in movement. There's better quarantining than we had in the first wave. So all of these things will play a part in keeping the actual mortality down, even though people may be testing positive. This is just a view of a map of the UK, and basically the more blue the area, the worse the number of cases are. And certainly what it seems like is that it's all up in the north and there's not much going on in the south relatively. But actually, if you start focusing in on the graph, you'll see even in London, London's a much worse picture than you first think. And certainly in some places we're getting, lots and lots of cases, and I think that's important to bear in mind. And even though if you look at this as you think, oh, there's only 5 to 10 cases in each area, but actually if you add the whole of the area up, it's still a significant number of people who've been infected by COVID-19. Now, I wanted to sort of make some reference to this infamous R number that the government's always talking about, and it's basically the value which tells us if the R value is, it's basically how much somebody else can infect other people, or the infectivity, if you want to think about it like that. So the current R number is within the range 1.3 to 1.6, and you'll have noticed sort of at the end of the last wave, we had dipped below 1, which was a safe place to be, which means that the risk of transmissibility in essence becomes very, very low. But now we are in a dangerous situation, and the latest growth rate for the UK is 5 to 9% increase. And you'll see that the regions such as England, east of England, London in particular, and the northeast and Yorkshire, I mean, these are quite high growth rates that we're looking at. And you have to remember that that infectivity of COVID works on a slightly exponential rate, bearing in mind all different factors. And those numbers are almost certainly going to increase in the next few weeks and potentially months. COVID-19 deaths in hospital by date of death in England. This was another important graph that I thought we should show. And of course, you'll see that in the first wave, we had significant numbers of deaths, and now it looks like it's tailed off. But actually, this graph in some ways is false economy for people who are thinking, oh, well, we don't have that many deaths, because you have to remember that we are still at the beginning of the second wave, and I would expect this curve to start trending upwards in the next few weeks, certainly. Maybe not to the same extent that we had in the first wave. It's possible that we won't. I mean, it's really difficult to tell because there's a number of factors that we're going to talk about which will confound this whole picture. But I think certainly from what we learned from the first wave and from what I just said right at the beginning when he introduced the topic, the believer doesn't really want to be bitten by the same hole twice. So I think it's sensible to take precautions even now. So I want to think broadly, actually. I want everybody to think a little bit more broadly. So we've really been talking about COVID-19, but the season isn't just, and Sister Zala just talked about flu, which is something that I will touch upon as well. But this is the season, and we're very much into the season now, of RSV, respiratory syncytial virus, which is something which predominantly affects children. It can also affect adults who may be immunocompromised or immunosuppressed in some way and can cause bronchiolitis. Now, this can be quite severe for many children, and in some children it requires hospitalization, sometimes needing intensive care management. When the winter season is particularly bad, I remember when I was a slightly younger doctor that we had to transfer a patient from our pediatric emergency department to a hospital in France, which was the nearest available intensive care bed, because all the others had been taken up for pediatrics. And you know, there's other viruses that we need to think about. So influenza, we've already touched on. Measles. Measles has been flaring in the last few years because we are now seeing the effects of the anti-vax campaigners, their children actually, who are now sort of teenagers, young adults, who are unfortunately being infected with measles. And we certainly have had outbreaks in certain areas of measles, which is potentially very lethal in an adult. There's other viruses that we see quite commonly: the rhinovirus, bocavirus, enterovirus, adenovirus, rotavirus. These are quite common viruses that we see in the winter season. Pertussis, whooping cough, that becomes quite common as well. And TB is not more common in the winter, but it has more potential to infect people for reasons that we will discuss. And the other point I wanted to sort of mention at the bottom, which is polyvirology, is something that not many people are aware of, that children in particular tend to not just get one virus, they tend to get 2 or 3 viruses at the same time, which may sound very strange, but that tends to be the pattern in which children get infected. And if you think about it, firstly, their immune systems may not be as well developed as adults, and their level of immunity due to exposure may not be as good, but they have contact with many other people in terms of schooling more than adults do in the workplace. So they're much more liable to get multiple viruses. Now, what we are entering a winter season with COVID for the first time. So I have no idea what the polyvirology is going to look like in terms of COVID as well. I mean, are we going to? I mean, we certainly have. I've seen children with influenza, enterovirus, bocavirus, rhinovirus. You know, the other types of coronavirus. I mean, I've seen children with all these viruses together, and I would be very surprised if we didn't see polyvirology with COVID. How that's going to affect systems, we don't know. I mean, part of the problem that we're going to have this winter, there's lots of unknowns that we actually just are not sure about, and we'll find out as we go along. So these are these are many of the viruses, and actually there's 2 bacteria there that we need to be conscious of, that, you know, they're going to play a very different role potentially in this winter. And one of the ways that we know how our flu season is going to go is that we tailor it very much on what happens to Australia, because, as you'll know, Australia's seasonal variation is different to ours. So their winter is in our summer, and their summer is in our winter. So their winter comes before ours. So we tend to get an idea of how our flu season may go. Now, interestingly, their flu season has been pretty good, actually, if you think about it in comparison to what it was. So this is their flu season from the previous year, and this is what their flu season looks like now. Now, looking at this graph should not make us think, oh great, our flu season is going to be fine as well. There's many different factors for why people's infections may be different, and that's not to say that Australia didn't have any flu. They certainly did. There was about 20, or I think it was on the next slide, 20,000 cases. Now, that may seem small, but you have to remember that because of certain restrictions that people have been implementing in their countries, locally, lockdowns, I mean, certain parts of Australia were locked down for ages, that would have had a natural consequence on the rates of infection. But each country is in a very different situation. You have to remember that we are, you know, our schools are all open. It is mandatory for our children to go back to school. So the possibility and vectors of transmission are still very much in play. I wanted to take some of this information from the Australian websites, the public health websites, and just focus on a few things. And that is that there have been low case numbers of laboratory confirmed notifications for influenza during the 2020 season, and they've made a point to say that 21,156 notifications of laboratory confirmed influenza and 36 deaths have been notified to the national system. Now, I think there's a few points to remember there. The first thing is that that's very good in terms of the number of cases and deaths. I mean, it's obviously not good that anybody dies at all, but relatively speaking, there's been a low number. But we don't tend to test children that much at all. Children are tested in much lower numbers. They tend only to be tested usually if they're admitted to hospital. Otherwise, children become unwell, we treat them at home with Calpol and ibuprofen, and they tend to get better after a few weeks. And sometimes they'll get antibiotics if we're particularly worried about them. But one of the problems I think that we're going to have, one of the great challenges, and we'll talk about it again, is that our children are back in school. You know, our children are potentially cross vectors of each other. Now, I'm not trying to say that you should take your child out of school, because that is against the government guidance. But I'm saying these are things that we need to pay some attention to. And winter, and looking at some of these challenges, winter in itself, what it does is it puts people in much closer proximity than they normally are. There's obviously less ventilation. People don't keep their windows open in the winter because it's cold, and they keep their heating on. The heating obviously dries out the environment as well, and that can become problematic. People cough and sneeze in smaller spaces, or spaces which are more confined, and viruses are able to concentrate in areas better. The immune response, as we know, when it's cold, certainly dips. We're going to have the additional problems of local lockdowns in various parts of the country, quarantining, which again, may produce some other unintended consequences that we didn't expect. There'll obviously be a difficulty in accessing services for people. And certainly the one thing that I have found as somebody who treats infections all the time is that post-COVID, I've never seen so many people suffering from such sort of difficult infections to treat. I mean, generally people get sort of mildish infections and they tend to recover, but I've been seeing people with a lot of quite severe infections in the hospital, and it's been quite sort of eye-opening and startling how many patients there have been in that situation. Schools, obviously, we've mentioned some of the problems and challenges related to that. Stabilizing the economy is obviously the government's agenda. We don't want to be in a situation where the economy is completely failing, which will cause other problems. But again, having said that, keeping schools open, keeping establishments like restaurants and other sort of hospitality industries open to maintain the economy will potentially have an effect, and especially in the winter season, for the reasons that we've already discussed, it could have a negative effect. Going back to what Sister Nuzhat was talking about in terms of vaccination, what are the challenges going to be around vaccination? We know that vaccination uptake is exceedingly poor. We are hoping in the context of COVID that influenza vaccination will increase substantially, but that remains to be seen, and that remains very much up to the community. And I know certainly the Muslim community is very suspicious for various reasons of vaccinations, notwithstanding the porcine element of the Fluence nasal spray. And again, I think you need to take local guidance from your local ulama regarding whether you feel that it's acceptable to give your child the nasal spray, and if you don't, then clearly the injectable vaccine is available. One of the other problems, of course, that we've had is there's no increase in healthcare resources. We haven't magically had more hospitals. There's not any more beds. In fact, some of the challenges that we have are that the amount of tests that are available to us are actually very limited, and people may not realize that. But certainly in terms of getting some rapid testing, it's very small numbers that we're talking about. So those are challenges that we are going to have to deal with in the hospital and primary care settings. I just wanted to mention really quickly and I'm nearly at the end now, some cases from this weekend that I was the on-call consultant this weekend. And I think the first thing to mention is that what you may traditionally feel are the symptoms of COVID are not necessarily the case anymore. And that may be for a number of reasons, and they're all too sort of difficult to go into at the moment, and I suspect would need a whole discussion in of itself. But I had a patient this weekend, a young lady who was pregnant, and her only symptom was that she had a blocked nose. And when I phoned her to tell her that she was positive, she just did not believe me at all. And she said, "I just don't believe you." And I said, "Well, be that as it may, my duty is to tell you the result. I can't force you to believe it, but I'm telling you that the result is a positive, and it's a strong positive." Again, the test and trace government system will be in touch with her, bearing in mind hoping that it's working, which I think it has been recently, and you know, that's one of the challenges, that people think that their symptoms are not going to be. I mean, they expect to have fever, cough, you know, loss of taste, sense of smell, all the rest of it, and it may not be that. There was another man, a young gentleman I phoned with a positive result, and he phoned me back after 5 minutes and said, "Can you tell my wife that the result is positive?" Because she just doesn't believe me. So I had to tell his wife the same thing all over again, because they thought the symptoms were so weak that he couldn't possibly have COVID. Now, the third case, I think, was the most important one out of the three, where a mother whose child, 11-year-old child, was due to go to a cancer hospital in Manchester to have quite sophisticated radiotherapy. Basically, she tested positive on the weekend, and she had been having regular tests throughout the past few weeks to make sure that her son would be able to go to have his chemoradiotherapy. Unfortunately, because she tested positive, his chemoradiotherapy has to be cancelled because he's now a contact of somebody who's positive and he may be incubating. So that's had a significant impact on that young man's treatment for his cancer. And whilst it may be a fairly rare case, but it just highlights the importance of maintaining all of the precautions that we can take as individuals and as communities, because it can have an impact on other people. So I just wanted to finish with last two slides about actions. What can we do personally and as a community? The first thing, obviously, is our own personal health. You know, make sure we get vaccinated, certainly for influenza. For COVID, as Sister Nuzhat said, there isn't currently no vaccine. We don't know when it's going to be coming out. We don't know about its efficacy, but certainly what BIMA will do is to provide further information as and when we know it regarding the vaccine, and some of our thoughts collectively from our colleagues as well in the industry about whether we feel it's safe, efficacious, and how people can take that forward. I don't know why I've written marinating. I think it was autocorrect, but I meant maintaining a good diet. And remember, one of the things that we've learned from COVID is that people who have very poorly controlled diabetes, who have very poor lifestyle, who are obese, they are all at very high risk of getting COVID and having significant complications of COVID. So maintaining a good diet, controlling our conditions like our diabetes, our asthma, and other things are important. Maintaining some level of exercise. Now, it's not easy to go to the gym nowadays. It may even become harder. We may even go into a second lockdown. It's very possible. But have some system of having some exercise, even if it be body weight exercises at home, something really small that you can do regularly. You don't have to go into the gym and sort of lift weights and run, you know, 20 miles. I mean, that's not what anybody's asking you to do, but maintain some level of exercise regularly. If you are smoking, please try and stop. It is not going to help matters at all. Limit unnecessary interactions. You know, the rule of 6 obviously is there at the moment. We may go into a full lockdown again. We don't know at the moment. There are obviously some caveats in terms of families and social bubbles within the government guidance, but please pay particular attention to that. And of course, washing hands regularly and wearing masks in public and certainly in spaces where people may be at risk. And sorry, just the very last slide, I'm just going to mention these 2 quick points. Communal actions, obviously maintaining precautions in the masjid as per the BIMA guidance has been listed many times, and ensuring that we help people in our community. And I'll stop there because I think I've taken more time than I said I would.
No, I apologize for interrupting you. But it was very useful to have the practical tips there. And I think you've been very clear that we are in our second wave. So it's time to get our act together, inshallah, if we haven't already. There are a few questions there, but I would like to do them with at the end with Brother Mohamed Omer, because I'm conscious that Maghrib is coming up in London soon. So if with your permission, Dr. Qureshi, if you're hanging around, inshallah, we'll do the next section and then come to you.
Yes, of course, that's perfectly fine.
If you don't mind stop sharing your screen.
Sorry, yeah, of course, yeah.
Thank you. So our next speaker is Brother Mohamed Omer from the National Burial Council, and he's also runs the Gardens of Peace Cemetery in London. And Brother Mohamed Omer was instrumental very much at the beginning of the COVID pandemic. We were in this really scary situation where we didn't know whether the government was going to mandate cremations. We didn't know what was happening in parts of Italy. We didn't know whether we had enough burial spaces. We didn't even know, there was issues around the ghusl or no ghusl. And alhamdulillah, we're very blessed. We had National Burial Council here with experts in the funeral care industry who were able to lobby and discuss with the government, but also to walk the community through what the next steps are and to reassure us that if something needs to be done, that they had their finger on the pulse and they would get it done. So now we're coming into the second wave, as we've been told by the medical side. What is the update that we need to know in terms of burials? I hand over to Brother Mohamed Omer, inshallah.
Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh. Muhammad salli ala rasulil karim. Amma ba'd. Jazakallah khair for that, Dr. Wajid. My previous two speakers have alluded that we have already started on the second on the second wave. And I can say from the ground that it has started to take off, sadly. And we are now seeing in the last week, we have started to see the rise in numbers of COVID-19 cases, not only in London, but right throughout the country. So I'm just starting to collate a lot of information of how many deaths have occurred during the whole of the last week for the whole of the country, and the trend is a rising trend. So we should really now be prepared, because we were not that prepared for the first wave, but for the second wave, really we have no excuse. And this is why it is important for us not only to adhere to the guidelines sent out by the government, because it is very, very serious. And what I would like to just re-emphasize, that this virus is not a hoax. This virus is serious. And those who have had this virus will be the best people to tell you how much it's damaged their particular health. And I can just tell you of one particular individual. He contracted COVID as a young man, maybe between his 30s and 40s, in March. And 6 months later, he still has signs of the effect of COVID-19, including on his neurological system, on his kidneys, on his liver. So this is a real virus. So please do not for 1 minute think that this is a hoax and we should just ignore it. And I think part of the reason is that some of us do not want to believe that this virus is for real, and therefore we just tend to ignore the guidelines set out by the government. And that is dangerous from our community perspective. Remember, the deaths in the first wave clearly shows that the BME community are more likely to contract this virus and die from it than any other community. So we should be mindful, and we should really be on top of it to ensure that we are a lot more careful than any other people concerned. We are at heart always trying to say, well, Allah will protect us. Yes, Allah subhanahu wa ta'ala will protect us, but He's never you should not take precautions. And therefore, when people are putting in measures for the safety of the whole of the community, people should not deride them and say that, why are you doing that? This is, Allah will protect us. You don't do that, because we're just doing a protection measure for the whole of the community. And remember, we do not want to be targeted to say that the Muslim community were responsible for transmitting the virus, even though it's not true, but we do not want to be in that particular situation. From the first pandemic to the second wave, those people who are involved in communities, I urge you to ensure that those people who helped in the first wave are already there and ready, because without the volunteers who really stepped up to the mark, we will not have been able to carry out the Muslim burials in accordance with our requirements as quickly as possible. The community rose to the challenge. A lot of volunteers came forward who were able to give ghusl, who were able to ensure that we had adequate storage space, who were able to ensure that the community had PPE. All those elements, we need to start preparing for them if you have already not done so. So my urge and my plea to everybody from the community would be that in whichever area you are, please ensure that you have got everything on the ground so that there is an issue that we can at least contain and we do not have to worry about the burial aspect of it. Also, can I also mention to you that in the first instance, we had a lot of guidance from different places like NHS, PHE, all of them were contradicting. Now we have come almost to a stage whereby most of the advice is cohesive, so that you can understand that, you can give ghusl safely as long as you've got the necessary PPE. So all this is important. And also sometimes we need to understand that the government are really not up to speed on all the particular practical requirements from different faith communities. And it becomes very challenging for them. From me and my perspective, I challenge the government on a weekly basis as to what we can do, because some of them really does not fit in with our particular normal culture or normal practice. And one of them would be reading Salatul Janazah. And they've only permitted using Salatul Janazah, and there's no restriction as long as you follow the COVID-19 restrictions for places of worship, as long as it's immediately after a Farz Salah. Otherwise, there's a 30 limit. But they're already talking about to say that if there is a local lockdown, they are thinking of reducing that number to 6 for funerals, if it's not for a congregation prayer. So we have to be mindful that there will be restrictions coming again, which we experienced in the first wave. And for that, the community must be prepared to adhere to it. This is not a time whereby we have hundreds of people attending janazas. This is not really on, because we are contravening the guidelines. And if we congregate, unfortunately, our community are not the best community in trying to ensure that we have social distancing or that we wear the masks. We are not that adherent to the guidelines, but we need to be. And therefore, please, if you do happen to, there is no need for people to go to people's houses to offer condolences, specifically when there are restrictions involved. I know that it is always our tradition to go to someone's house as soon as somebody passes away, but that in this thing, people should be very much aware of it, that we cannot afford to do that. Are we as a community prepared from the legislative perspective, as we were in the first one? Yes, alhamdulillah, alhamdulillah, we have made so much progress. And alhamdulillah, the registrars, the coroners, the doctors, and most of them during the first wave really helped the faith community to ensure that the necessary paperwork was processed as quickly as possible. So that is one thing which is reassuring. Burial space, by and large, yes, it will be sufficient, but we cannot be complacent. We need to ensure that we do not only think about December, we think about long term, that do we have adequate burial space for the Muslim community? Remember, from the normal statistics, we have about 600,000 people die every year, of which 80% are cremated. Only 20% are buried. And from that 20%, a substantial majority is the Muslim community. So space is always going to be an issue for our community. And therefore, we should be prepared to ensure that we are lobbying our normal councils to ensure that they have adequate burial space available for the community, so that we do not have an issue when we have a pandemic, because this pandemic is not going to happen now. There are going to be a series of pandemics which will occur, and we need to be prepared for it. So this is why it is important for us to prepare for a second wave. From the guidance perspective, National Burial Council, at the moment, we don't need to change any of the guidelines in terms of what you need to do for ghusl, what you need to do for update for janazah. But if we get any updates through MCB, we will be ensuring that we provide you the updates which you will require, and it will be posted on our website. But what I would once again say, that those who are actually dealing with end of life and dealing with funeral services, please ensure that you have adequate stock of PPEs from now on, before it gets a bit worse in terms of supply side of it. Get your volunteers ready, and also ensure the guidance that this particular, if you have to give ghusl, make sure the age is important. Not elderly people should not be involved in ghusl. It should be the young people who do not have any underlying conditions. That is important, so for us to stay safe. And also, when you go to the cemetery, please do not bunch together. Make your social distancing, because it is important. And for me, we have put restrictions at our cemetery, but regrettably, for every funeral, even though we plead with the families, at every funeral, more than what we have prescribed will turn up. And then they try and argue with us. And all we are trying to do is keep them safe and keep us safe, which is very, very important. So please, can the Muslim community, we have been in the forefront. We have done so much to help the community at large. We should be an example that we are going to be a community who are going to adhere to the guidelines, and we want to make sure that our community is safe. And those who are vulnerable, please ensure if we have a second wave coming in, then more restrictions are going to come through. So please let us look after those who are vulnerable, those who are in a very serious category of isolation. We should be looking after them as well. So these are all going to be important messages which we need to make sure. I also gave an example to the government to say that it is very common that if my mother, if you put a rule of 6 at the moment, if my mother is on the last stages and she's at home, all the siblings are going to get together. How are you going to police that? Because you are saying only 6 in a household. So there could be 20 people in there. How would you be able to do that? And the answer is that they cannot do so because they cannot legislate for everything. So my point being here is that we need to be using common sense where we are trying to approach the second wave to try and ensure that we do not be responsible, or we try and protect the community more than anything else. Remember, our frontline, I have also asked the government to ensure that the BME community who are in the front line should also be protected and should not be let in the front line if they are at serious risk. In the first wave, we lost a lot of medical doctors, we lost a lot of frontline staff who are from our community. And part of the reason was that they were not replaced, or they were put in a category whereby they should have been moved to another level, but they were not. So we want to make sure that there are robust plans to ensure that even our own community who are in the front line are given the necessary precautions and given the necessary PPE in order to carry out all their jobs. So this is an important plea to all of my people concerned over here. I always say that in the first wave, with Allah subhanahu wa ta'ala's blessings and all your du'as, we were all able to cope through the whole of the country. All the Muslims were buried. There was no risk of anybody being cremated. There was very little storage capacity issues. The community got together, rose to the challenge. We had our own storage facilities. We managed to do that. And from the data which has been presented by Dr. Imran, remember, it could be that we could have a higher death rate. We are praying that it doesn't. All the modeling doesn't suggest that it will be as high as the first wave. But if it is, we will be struggling to cope with the numbers of burials. Not in the sense that we won't have burial space, but more importantly is the essence of trying to bury somebody as quickly as possible. Just to give you a flavor, at the height of the pandemic, in April and May, we were burying at Gardens of Peace 20 funerals a day. And we had the capacity to increase it to even further should we need it to do. And this was single burials, not mass burials. So we can do it, but we also at the same time need to ensure that we do not ignore whatever the guidelines have been suggested by the government, because it is important. And our first speaker, Dr. Nuzhat, as PhD, she will tell you how important these guidelines are. And she's part of she's part of the team which produces the guidelines. So please do not ignore it. Please let us be sensible about it. After all, it does say that we should, as a Muslim, should not harm anybody. So we should do something which is a principle of our Islamic teachings, that we should not be a cause for anybody's problems, or try and give any sort of health issues to anybody else. So we should be living by examples. And this is my particular plea to everybody concerned. The MCB, but in particular BIMA, have done a fantastic job trying to keep everybody abreast about all the issues pertaining to COVID-19 right throughout the pandemic, and continue to do so. And I'm pleased to be working with BIMA on this issue. and also the various panels, my Shura panel on National Burial Council, Dr. Mufti Zubair Bad, Dr. Yunus Dudwa, Maulana Yunus Dudwala, all of them came together to ensure that we were able to fulfill the rights of an individual when they die for as much as possible. And we managed to do that in the first wave. And I see no reason why we cannot continue to do so in the second wave, but the plea would still remain with everybody concerned that we have to be sensible, we have to have common sense approach, and we have to try and follow the guidelines so that we do not have a higher level of mortality. What we don't want to do is to ensure that we are subjected to a higher death level and which will not be able to cope in the manner which we wanted to cope. So before I end, the one plea I would have to say is please remember all those who have perished in the first wave, so many of our brothers and sisters who are still coming to terms with the loss of their loved ones who they could not even go and see or could not even attend the Salatul Janazas or be at the burial. Please make dua for them, and we make final dua to Allah subhanahu wa ta'ala. Ya Allah, please remove this virus for the whole of humanity so that we can go back to some normality. I will end on that, and I know I'm over the limit, so Mohamed, Dr. Wajid, I will end there. If there's any questions, I'm happy to take.
Jazakallah khair, and thank you so much, Brother Muhammad Omer, and Amin to your duas. We're going to wrap up in literally in a couple of minutes. Before you go, I'd like to ask Sister Nuzhat, yourself and Dr. Imran as well. Sister Nuzhat, if there's one key message that you would like, I know there's many messages we want to get across, but if you wanted to get one key message across to the Muslim community, what would that be?
I think the key message is that the guidance that we now have in place that covers flu and COVID, and what we need to do, we've just heard from Brother Mohammed Omer as well. Please, the plea is that please follow the guidance, and you know, whether that's social distancing, wearing masks, getting your flu jab for yourself and for your children. Please follow the guidance. That would be my point that I'd like to get across, please.
Spoken like a true public health specialist. Dr. Qureshi, what is your what would be your key message if it was slightly different from Sister Nuzhat's that you'd want to get across to everyone?
It's not fair. My key message would be the same, really. I think this issue of responsibility and not falling victim to conspiracy theories that other people may be peddling. This is a real problem. This is a real issue. It has had real consequences. So please be responsible.
Jazakallah khair. And I think that's a really important message. Unfortunately, we have a lot of messages in the Muslim community. Alhamdulillah, by and large, we're doing very well. But there are some messages, people saying, is it real? And as Brother Muhammad, you have to ask the person. I actually tell Brother Muhammad Umar, I tell people, I said, if you want to know it's real, I can introduce you to the person burying them. He'll tell you for sure whether it's real or not. Or I can introduce you to the widows and orphans, and they'll tell you for sure as well. So there are these messages going around that maybe it's not that bad. So I think that's a really important message. And Brother Muhammad Umar, from your side, if there was a key message that you'd like to get across to the community?
My key message to the community would be, whatever my two panelists have said, I'll endorse that in terms of ensuring that we follow the guidelines. But more importantly, is please be prepared for a second wave. So whatever facilities we need to have in place, let's make sure that all our community centers or whoever is involved in this particular sector are prepared for it, so that we are not caught on the hop, and we have prepared should they occur. But obviously our du'as are that it should not happen, or it should not happen at that level, but we should be prepared for it. That's what I was saying.
Jazakallah khair. One or two specific questions actually for you, Brother Muhammad Umar. Yes. Does the rule of 6 apply when performing ghusl on someone who's passed away from COVID?
From a person who's passed away from COVID, our particular information is that if there is this rule of 6 does apply there, but it is also very important that those who have an underlying conditions should not perform ghusl. And if you are performing ghusl on a COVID-19, we strongly recommend that you have the full PPE gear. My own view would be is that the less number you have in giving ghusl to a COVID-19, the more secure you are and the more safe you are. That would be my particular advice to everybody concerned.
Jazakallah khair. Okay, I would like to finish off on this point. I want to keep it tight. I know it's Maghrib time as well. The MCB, inshallah, will be facilitating, as the umbrella body it is, to bring together the experts in different fields on a more regular basis, inshallah. There are many areas that we need to cover: the mental health impact that's happening, the economic impact that's happening on the Muslim community, not only when it comes to people losing their jobs, but how is it affecting Muslim businesses, mosques, scholars giving us the guidance, Islamic guidance, how we should be looking at this, COVID-19, and so on and so forth. There are quite a lot of information that we can bring together, inshallah, and hopefully MCB will be doing that in the weeks coming ahead. Please do share this information with your communities, because the more good information we can spread, the more likely people are to get that message out there from the experts, inshallah. And please do give your suggestions as well. The MCB website has information, and you can email as well about COVID. So if you go to the MCB website, very easy to use, very easy to email questions. I'd like to finish with this last point, that may Allah subhanahu wa ta'ala protect us from not only from the second wave, but from the impacts of the second wave. May Allah subhanahu wa ta'ala protect our families and our communities, both here and across the world. It is difficult times, but one thing is for certain, that it becomes a little bit less difficult when we are together. We're united together, inshallah. We work together and we make dua to Allah subhanahu wa ta'ala together as well. And remember that when we are sick, then it is He that heals us. So, Jazakallah khairan, everyone. A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Wal 'asr, innal insana lafi khusr illa allazina amanu wa 'amilus solihat wa tawassaw bil haqq wa tawassaw bis sabr. Wa jazakallahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.